10 minutes, just over slightly before the break for questions and answers. I said at the beginning that if you had any questions for any of our panellists to jot them down and save them for now. So now's the opportunity. I think we can probably use one of the roving mics, and if not, I'll probably have to nick yours, Sue, and then come back to that. So any questions? I'll risk the tumbleweed moment. I don't know if our panellists would like to come up here and... Perfect.
From Bath. I was interested that you had a 99% consumer feedback satisfaction rate. But I wondered how you manage that with people with dementia, especially advanced dementia, who have often completely forgotten that they had anything installed at all, or even that there was a problem. So how did you manage to get feedback from people with advanced dementia?
Do you like that, John?
I think I'm somewhat.
Yeah, there you go.
That 99% is based on those people that were responding. I mean, I take the point about dementia. And, in fairness, I don't think I could say wholeheartedly that definitely included a full kind of response from people with dementia. But that was very much, carers and those people able to respond. So it was a fairly significant, if you like, cohort. But obviously, there's still a little bit of work to do to make sure that we cover the whole of the community.
I think there are imaginative ways that you can get feedback from people with advanced dementia. I use little stories about people who were confused and muddled and their family was worried about them. And I got feedback from people with all levels of dementia.
Thank you for that. Thank you.
Thanks very much.
Thank you, Stephanie Caledero, Joseph P.S. Program Commission. My question is for John. Very interesting model of public-private partnership. I like the presentation and the details also. But I have some question about, you talk about evaluation, but evaluation only about savings. I don't know if you evaluate some indicator of quality of life or specifically about independent living. If you did so, just if you have some more information about this. And also about quality. Because I remember that you talk about that you have a specific citizen advisory board that establishes quality, but I don't know how you assure the quality, and just mostly this.
Okay. I think that is one of the dangers, that money, can dominate if we're not careful. And in fairness, that's not been, if you like, the whole driver. It's been important. I mean, the Good Governance Institute work has been important to kind of assure some quality levels. Obviously, we've got the usual kind of monitoring through the commissioning, monitoring arrangements that we have. And we do have quality assurance arrangements. My commissioning team have responsibility for ensuring the level of quality too. So that will be kind of in visits, in feedback, the whole normal, if you like, kind of cross-section of things that we would do to monitor any contract to make sure that the outcomes are being met. So it would be talking to citizens, it would be actually going out looking at what's being delivered, how it's working, response rates from provider, and we actually have a monthly board where we actually look at that information, and people like Simon and myself actually sit on that board. I chair it to make sure that what's being delivered is of an acceptable and high standard. So we use a range of things really to kind of make sure that quality is high. But for me, again, one of the biggest issues is making sure that the citizen, the carers and the families are feeling that what they're getting delivered to them is of a high quality.
Okay, thank you. Any other questions that we've got?
Jim Allen from Staffordshire County Council. I'm interested in actually what Alison and John were talking about creating pushing the telecare model to wider communities. I wonder what your view is about trying to create a pull from the public, because a lot of marketing seems to be the usual suspects, people in housing, education, social care. But not all the marketing actually hits mainstream, for example, television. Alison will know I talk about Coronation Street, and we've been reading Fair Club.
Yeah.
Having something on there about how telecare could help in the storyline would be quite powerful, but it seems telecare is one of the best kept secrets. I think the Carers UK did a research recently and showed that most people didn't know about it, but those when they knew about it wanted to use it. and thinking of self-funders and the care bill, how can we create that pool in the wider population? Views on that?
Yeah, that's one of the big things. We have a bank of 377 organisations who are all members of TSA, all paying separately to market telecare, and we're still static at 1.7 million. Within the TEX programme, nationally, NHS England, one of the key things, which some of you in the audience were at the road shows, in the delivery plan will be a push into how we're actually going to get a national campaign. A national campaign, like a smokers campaign, what would that do for the industry? Yes, something on a national TV with a storyline. But I think this is where TSA as your industry body has to do some work too. So we've pulled together a special interest group to look at what are we spending with our membership. So what do we spend currently, individually from Tunstall, from Your Homes Newcastle, from TimeTech and all of the industry partners and service providers. And the special interest group is looking at that key message. How can we get that key message out? Because we can't just sit here and wait for government. That would be great if NHS England can get that done. But if they can't, what can we do from the trade body, from the national body, to get something pushed out collectively and collaboratively? So watch this space, because we're working on that now, and we'll have something to share with everybody by the summertime, I would think.
On a more local basis, I mean, obviously that's the national and kind of, the wider picture. What we've tried to do is actually use some of our big care centres. We went through a programme a few years ago of kind of reducing and in fact closing a lot of residential homes which weren't fit for purpose. We built some very big care centres which were meant to be the bridge into the community. And I mentioned earlier about working closely with third sector, and I think that's what we've tried to do across, parts of Birmingham to actually get the message out. Because, I mean, obviously we're keen that self-funders are aware and, kind of are able to access this type of service. So that's been some of the local response that we've taken.
Can I just add sorry.
I think we have different messages across the whole industry. We have messages around what we're trying to push out, what telecare is, what telehealth is, and as I spoke about in my presentation, that the 3 Million Lives campaign is now technology-enabled care and support. I think as a sector, we need to decide what that key message is. And we haven't decided because we all say different things. And telecare, telehealth, telecoaching, this means different things to everybody. If we can pull the key themes and messages targeted at the individual in the home, the carers, and what does that all mean and how we do it, then I think we've got just one way of actually getting out there, because we all have a different way of articulating the key themes. So let's work together about what they are.
Can I just add that that's why we've got a session called Rebranding Telecare that's running in our parallel sessions, because we want people to think about how we're going to actually get the image of the range of products that's available and the services that support them into people's understanding so that they become something which people want to have. And one of the things I think we've got to really think about is there may be a bit of an image that having telecare is about not being just safe at home but being stuck at home. And that isn't what a lot of older people want to be, although that is what many of them are. And some of the products that were beginning to be introduced in the samples we looked at, including some of the GPS-based systems which enable people to continue with activity, and which Leeds City Council has been developing through and delivering through its telecare service, a range of products there, are really helping people to keep active and do things they want to do. We've got a number of examples that you'll hear about during the conference of people for whom those things were transformative. And I think we just need to get people to see that these are tools for living, and it's not about you just kind of quietly sitting away at home and waiting for that day when you get taken into hospital and you need to press your button. It's actually about enabling the whole of your later life to be more rewarding, and that's, I think, the message we need to get across.
Thank you. Any others? You've got 1, 2 questions. We've only got time for both of those. That's just about.
I'm Barbara Train from the American Housing Association. We do the telecare service in Bedfordshire with the councils. One council has a no-charge service, the other council charges. One of my questions is, how are we going to get around people being able to afford telecare if they have to pay for it, if it's not included in care plan.
Okay. Can I ask for a local view, John, from you? I mean, obviously you have a free picture, but...
Yeah, I mean, we're absolutely... I mean, I think you've got to kind of convince and win the argument about the benefits and values of the long-term kind of implementation of the programme, really. We believe in it, and I think, you know, it's kind of convincing people like politicians, local politicians, etc. Because at the end of the day, you know, the reality of public funding at the moment is that to go for one thing means you don't go for something else, and, you know, some things are going to be, you know, lost forever in terms of service. But, you know, from a Birmingham point of view, we were clear that this has major long-term benefits. And so we've kind of, if you like, put money where mouth is in some ways. But it is about convincing all those key stakeholders. And I would say the NHS, again, you know, are becoming really, really important here. And we're having some very interesting conversations with GP practices and with clinical commissioning groups and the, you know, the kind of the chairs and the accountable officers, etc. So I think it is about kind of pushing that message and winning the argument almost.
Yeah. From a national point of view, the work that's being held with NHS England in the TEX programme is predominantly about commissioning and procurement and how do they start gelling together. So procurement of technology is very different. It needs to be different. It needs to be flexible. So if we have a national delivery plan that gives advice and support to your local commissioners how they can completely redesign their services, because if you look, you shouldn't be looking at the technology bit, you should be looking at how do we deliver those services differently for the individual. And if we can work more closely with commissioners, giving them models and business tools, how they can actually achieve that, then technology will naturally flow. At the moment, it's a bolt-on. It's a bolt-on, it's really, really difficult for somebody to engage in purchasing that equipment because you've got one, the marketing, but you've got two, that's not part of the care pathway. It's not part of the care pathway, it's not part of the assessment process, and they're two fundamentals to actually get commissioning to think differently. So lots of different users going in the person's home, lots of different duplication of services. Strip that all back and the money will be there for technology, and that's up to the national programmes around TEX, around NHS England to actually steer us the way if we can, and I'm sure we can if we all believe in it.
Thank you. And there was one last question.
It's really for you, Alison. My name's Peter Buckler and I worked on this project, the AKTIVE project. And one of the things which I want to believe, which you said, but I'm not sure that I do, is the extent to which we can get rid of some of the duplication, replication, and share better.
Yeah.
And the reason for that is I've also spent 10 years looking at how a health service has issues around these things. And all that seems to have happened in that time, there seems to be more layers of this have been brought in, so less sharing. And I want to believe you, but I'd just like you to give me a little more evidence about why it will happen.
I think in the past we've looked at shared assessment, we've always tried to create one technology platform for people to share information. What we've never done is redesign that pathway. We've never looked at what a social worker does, what a telecare person does, what reablement. We hear of lots of new services, but the creation of new services, they don't cut back and see how we can share those people. If we start sharing the people first, the information will naturally flow. You'll see examples up and down the country where they start to sit people together in one location. But what they're not doing is talking to the IT partners. The work that we're doing with ADI and other things on the programme is to look at, don't try to build new technology platforms, try and push and pull data where it's necessary, but work with the individual about what they want shared. And if they own it and they give consent, and there's no reason, under legal reasons or anything like that, why they can't share it, we'll start to see a difference. So the pull and the push has to definitely come from the individuals, and that's the work we need to do. Because in the past, we've just bolted on. Telecare is a bolt-on to everything else. Your industry partners like Tunstall and your universities and the AKTIVE programme are fantastic examples of huge pilots, but where does the integration, and this is back to commissioning, for commissioners to start working more closely with the telecare providers around a single assessment. Assessment in the community is crazy. In Newcastle, 11 hours of assessment from a discharge of hospital. with 5 different individuals. Now, if we can't get that right, then I think that's just a sorry state for social care and health moving forward.
I look forward to helping you with that.
Okay, well, I think we're coming up to the end. So first of all, I'd like to say thank you to Sue, John and Alison, and we'd like to show our appreciation to them. It was a really interesting overview of the policy and the challenges we face, what we're doing.